Good morning, everyone. On the behalf of Dental Desk Academy, we are here to speak about facial nerve. So we'll be discussing its comprehensive anatomy. Let's begin our slides. So we know that the facial nerve is the seventh cranial nerve. It is a nerve of the second brachial arch. Please emphasize on this. We'll be talking about it in detail. So it's a mixed nerve, that is, it has both sensory and motor components. Sensory with respect to taste, motor components that it basically innervates all the muscles of the facial expressions. There are about 23 muscles in here, and also it is parasympathetic to various glands like lacrimal gland, sublingual gland, and submandibular gland. Now, for the origin, it basically emerges from the pontomedullary junction. If you have seen the presentation on trigeminal nerve, I have specified that cranial nerve number 5 to 8, all of these emerge from the pons, and the facial nerve is specific. It emerges from the pontomedullary junction at the cerebellopontine angle. Now, it exits the cranium by the stylomastoid foramen. So it has a wide intracranial and an extracranial course. Now, for the nuclei, it is basically associated with four nuclei. First is the brachiomotor nucleus, which is responsible for, again, innervation of muscles of facial expression. Then it is also related to the superior salivatory nucleus and the lacrimatory nucleus. Both of these, as you can see in the slide, I have written PS, that is, it is to do with parasympathetic secretomotor functions. And the last nucleus which is concerned is the nucleus tractus solitarius, which gives the facial nerve the ability to innervate the gustation of the anterior two-thirds of the tongue, except the circumvallate papilla. Now, as I have already mentioned, that it is a mixed nerve, that is, it has both a motor root and a sensory root. So the sensory root is called as the nervus intermedius. So let's just discuss the various functional components once again. So as I said, that the nucleus, brachiomotor nucleus, is responsible for the motor function. So this is a special function. It's visceral and it's efferent. It is motor in nature. So it will be represented by muscles of facial expression. Also the stapedius muscle, which helps dampen down the excessive noise. Then the posterior belly of digastric and also the stylohyoid muscles. Please note that all these muscles arise from the second brachial arch. And one thing, when I said posterior belly of digastric here, you might have heard about anterior belly of digastric. Anterior belly of digastric is a muscle of the first brachial arch, and it is innervated by the mandibular nerve. So continuing, then it has an afferent or a sensory function, that is the special visceral afferent function, which is to do with gustation or taste. And the nucleus where all this information is relayed is the nucleus tractus solitarius. So please remember that the facial nerve is responsible for carrying the taste from the anterior two-thirds of the tongue via the chorda tympani branch of the facial nerve. Then you have various transmitter fibers. That is, I have told you that this is a general function. It's visceral, and again it is efferent in nature. So you have parasympathetic to lacrimal, submandibular, and sublingual glands. That is, it is responsible for causing secretion, secretomotor, to these particular glands. As I have already mentioned this earlier, so these are the four nuclei which are concerned with the facial nerve. You can pause this slide just to go through it once again. Now let's talk about the course. So facial nerve has two courses, an intracranial course and an extracranial course. So let us begin with the intracranial course. So the first part of the intracranial course begins in the internal acoustic meatus. So what exactly happens? If you can